There are a lot of therapies out there, over 500 actually. So, which one of them is the best? Well, it turns out that's not actually a very easy question to answer scientifically. One thing we do know is that therapy in general works well. Among the various kinds of outcomes that we measure in medicine, psychotherapy makes a difference in people's mental health. But what we don't exactly know is why therapy works, at least not specifically. And one of the big problems is the so-called dodo bird effect. This comes from Alice in Wonderland, where Alice is put into a race that is designed by the dodo bird. And in this race, there aren't really any rules. The dodo bird just says, start whenever you want, finish whenever you want, and all shall have prizes. In other words, when psychotherapies are placed head to head, neither one typically is shown to be on top. And systematic literature reviews looking into psychotherapy outcomes seems to show that this is, in fact, true. One good illustration of this is in the head-to-head studies of CBT, or cognitive behavior therapy, and EMDR, which is eye movement desensitization and reprocessing therapy for PTSD. It turns out that studies that compare these two therapies show that both of them work and help to alleviate the symptoms of PTSD. Well, how does this make any sense? CBT and EMDR have completely different explanatory frameworks. CBT, for example, proposes that our emotions are caused by distorted or inaccurate cognitions or thoughts, and when we examine our thoughts and analyze them for their rational accuracy, we can change them and hence change our emotions. EMDR, however, proposes to help with traumatic memories by focusing on the memories while having some other kind of bilateral visual or body stimulation, such as moving the eyes back and forth or tapping your fingers back and forth. And this supposedly mimics the brain's natural memory processing mechanisms, such as that which is found in rapid eye movement sleep. And this, according to the theory, helps to alleviate PTSD symptoms by processing the memories. So how is it that there's no real difference between these two treatments in terms of outcomes? Their explanatory frameworks couldn't be more different. Well, and this is one of the central questions in psychotherapy research. Now, one popular theory is the so-called common factor theory, which proposes that good therapy, no matter what it is, has common features that are the real key to improvement, regardless of the surface differences in theoretical explanations. Things like the therapeutic alliance, trust, understanding from the therapist, a creation of an expectation of cure, tasks and actions to perform, and so on. The contextual model, as opposed to the old medical model, which treats psychiatric syndromes as if they were medical lesions to be extracted via the proper procedures, proposes that these common factors are what really helps. So one consequence of this research is that as long as you're engaging in a legitimate therapy, you're very likely to get better regardless of what the therapy is. Now, what is a legitimate therapy, you may ask? Well, I'm very glad you asked that. It's a treatment which consists of four basic features. One, it's based on some kind of psychological principles. Okay. Two, it involves a trained therapist and a client or patient seeking help. Three, it's intended by the therapist to be remedial, which rules out things like waiting lists and just sort of shooting the breeze kind of therapies. And four is it's individualized to the particular recipient. So now you might look at those and think, well, okay, that's really general. And that is true, but it does help to rule out some of the things that sometimes get labeled as therapy, which aren't really therapy. So once you use those criteria and you start measuring therapies head to head, you get the dodo bird effect. Or the dodo bird outcome. So anyway, the key to getting better from PTSD then apparently is therapy. Just go. But of course, not all therapies are created equal. Some therapies, like, say, prolonged exposure therapy, is very hard for patients to tolerate because it involves them recounting the traumatic memories in gory detail over and over and over until you become desensitized to it. Kind of like flooding or systematic desensitization for phobias. Now, you might call this the beatings will continue until morale improves type of therapy. And like all other types of therapy, prolonged exposure does work, but it's a rough ride. Now, my choice, I think PTSD is very challenging and complex, and it can be horribly debilitating. Moreover, I'm not a big fan of tormenting my patients, even in the name of getting them better. I think there are gentler solutions, and I have found them to work. In my own case, I've found psychodynamic-oriented therapy as well as trauma-focused hypnotherapy works quite well, and neither of them require patients to recount their traumatic memories in lurid detail. This means that they're more likely to go through with it, and hence, despite the dodo bird effect, are more likely to finish it and get better from it. To me, that's a huge win, and it's a reason to use it, rather than some kinds of therapy which involve reliving traumatic memories. And in fact, I think that reliving traumatic memories in therapy can actually risk re-traumatizing someone and making them worse. Obviously, that's what we want to avoid. Now, I've also found that there's a symbolic dimension to this, and this is where you can bring in the dreams and the fantasy elements here, because dreams, symbols, and metaphors are very, very effective at helping to process trauma. This is something you find in therapy over and over again. If you treat the bad memories as themselves visual spatial images that can be manipulated, that can be very powerful. Even if you don't exactly get into the detail of what those memories are. This is what I've done in Ericksonian therapy, for example. I do remember one case where I had a patient who was complaining that their moods were going intensely from on to intensely off, i.e., meaning that they were either feeling rage or numbness. This is a common occurrence in PTSD. But I took the way that they were framing this as the beginnings of an attempted metaphor for them to use. So, in the context of a psychodynamic therapy with all the common factors in place, I introduced the idea of changing that on-off switch to a dimmer switch. It was a way to put the images of their negative experiences and feeling like they were attached to a light switch and saying, well, what if they're attached to a dimmer switch so you can have some gradations, but it's not all or nothing. This imagery of the dimmer switch popped up later in therapy, and the patient didn't even remember where it came from, i.e., didn't remember that I had suggested it initially. But it managed to help them process their emotional lability. Many, many other metaphors were used in this kind of therapy, and many of them came from their patients' own dreams, such as fighting giants, going on heroic quests, journeying with the wise mentor, a lot of those sort of archetypal things. And because they're so memorable and powerful, those help them to process the traumatic memories, get them out of the present where they were causing them all kinds of fight or flight torment, and into the past where they could be acknowledged and recognized for what they did and how they affected one, but did not feel as though they were reliving them in the moment. So a lot of this and a lot more in therapy was accomplished without going over any of the horrific memories themselves in detail. As such, patients going through therapies like this find it much easier to stick with the treatment. And I didn't have to feel like I was the evil Count Rugen, the six-figured man from Princess Bride, torturing people. And so for me, I feel like that's definitely a win. So bottom line is, if you do have traumatic memories, if you do have PTSD symptoms, know that you do not have to relive them in minute, fine-grained detail. You may have to go over a couple of the features of them, but for the most part, the healing doesn't come necessarily from beating you over the head with the memories over and over again. There are many, many other ways that you can get there. So that's what I got for you today, and I'll see you next time.